if it is a specific metatarsal bone stress injury, then really starting early with some intrinsic foot strengthening. So doing some doming or towel curls, or really, because as we know, any pain is inhibitory to muscle, and so if you've got a metatarsal bone stress injury, then those foot muscles, particularly those intrinsics, are going to shut down. And therefore they're going to decrease in size and strength. And then when you come back, you're not going to be in the same sort of position. So you really want to start early, even when they're sort of non-weight bearing, as long as they can do this without symptoms during the activity or after it, then you can start doing some easy sort of strengthening, non-weight bearing, or even sitting sort of, picking up balls between your feet, so working on tib post as well, and really working on that strengthening side of things as a way to get them engaged and active while they're sort of not able to do other things. And definitely look at their dorsiflexion in their ankle, and working on some posterior glides of their talocrural joint, even subtalar joint, and some of the other bones, joints in the foot. Because if you've got decreased ankle dorsiflexion, then that's going to increase loading on your metatarsals, and we've seen that in athletes who have had a metatarsal bone stress injury, that they've got this asymmetry, they've got reduced dorsiflexion on that side, and you're starting to think, okay, did that contribute to their bone stress injury in the metatarsal, because they're just bending it more to try and compensate for this lack of talocrural dorsiflexion.
Yeah. That just reminds me, unfortunately, of athletes I've got in my elite teams at the moment that have had surgical intervention to the ankle, and so just to float for the athlete, that two of them, I'm thinking in my mind now, both got within 12 months metatarsal stressy, and it's just that change in biomechanics. And you like to think at the elite level you program everything perfectly, but it can still go wrong, and so it's always having that suspicion of how can I change this. So
yeah. Yep. So, this is really sort of preparing them for their return to activity, these sorts of management things, and maintaining what they've got, so they're not deconditioning as badly, so that when they do come back from injury, you don't have that big spike in loading, and they've got some strength and so on. Definitely look at proximal chain work, looking around the pelvis, quadratus lumborum, the hip abductors. So doing some side planks, whether it's a static side plank, where you're going up and you're holding it for a certain period of time, and you can do it with the legs bent, so you're not loading through the tibia, you're not loading through the metatarsal, and making sure you're doing this bilaterally. You're doing it on both sides, but you can get some strengthening there where you do a static hold, or you can go up and down, and it's really strengthening the hip abductors. It's working that quadratus lumborum and working on that core sort of stability that will benefit you as you come back. And a lot of athletes may not even do this traditionally or normally, and it's often a good time. Hey, we need to start. This could be a contribution to your bone stress injury, and it's going to make you stronger and fitter and faster when you return. So, working on this sort of proximal chain, and if they can tolerate it, going out to straight legged, going up static hold. And again, this is all based on symptoms. If this is aggravating their bone stress injury, then go to the bent leg or change the loading. But doing a static hold or going up and down, doing more of an isotonic, concentric, eccentric sort of contractions.
With these videos that have gone through there, the viewer can watch, will you take them through, well, I guess as many as that they can in the clinic space with you, because they may be painful with some, and say, once you can do this do you give them a certain amount of time? Do you say once you can do this on 3 consecutive attempts, so different days, you then move on to the next one? Do you allow them to progress as they see fit type thing?
Yeah, no, definitely. I might try. Definitely, if their legs are straight, it's harder because you have a longer lever. Yep. So I might start there rather than bent leg and see, does that aggravate their pathology? Does that aggravate their bone stress injury? If it does, then I'll bring them back to the bent leg to take the load off the tibia or fibula or metatarsal or whatever. But I'll get them to do it, and then if they can do static holds for 3 days, then progress to going up and down. Yep. And doing sets or reps of those, progressing it. And then the last sort of couple of videos is so this is more advanced, where you're going up and then you're lifting an arm or a leg, and really and you're getting a lot more core stability. So really sucking in the tummy and working on core, working around the pelvis, getting quadratus lumborum and strengthening this way.
Yeah, it's a good cue, I think, that, I mean, to be honest, I don't think I could do these without an injury, but it's a good cue, sucking in the tummy and things like that, that I'm, I'm hearing good physios start to use, so I'm starting to use in my practice, probably should use myself. Yeah. But yeah.
Yeah, and trying to keep the trunk really straight, not rolling forwards on that elbow, not rolling forward on that shoulder, really staying sideways, so nice and stable. So that's working the sort of abductors and side sort of muscles, but also working that posterior hip extensors as well. So your traditional sort of bands around the legs and doing bridging, and progressing from two-legged up to one-legged as they can tolerate it. If it's a metatarsal stress fracture or bone stress injury, pushing through the heel, so they're not pushing through their ball of their foot. So that most metatarsal bone stress injury people can do these without aggravating their pathology, because they're pushing through their heel. Yeah. And really, getting their heel up towards their bottom, so they're getting more glute max and less hamstring, and just trying to keep these muscles strong and active for when they come back and start running again.
Yeah, or make them do it in the cam boot.
Yeah, no, exactly. Yeah, so definitely do it in the cam boot, and progressing up to over a bench as well. So really hip thruster. So you've got some abductor stuff with the TheraBand or with the rubbers. You're working on the abductors, external rotators, and then some extension on top of that. And like you said, put them in the cam boot. They can do this all day long in the cam boot, and you're not worried about them aggravating their pathology.